guest today is hospice social worker and agency owner Nathan Yemane, sharing his hospice journey and how he's carrying on his father's legacy. You're connected with the Heart of Hospice. I'm Jerry Finter, here with Helen Bauer.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
Today's episode is sponsored by our friends at GrandPad. Do you have an older family member who's isolated, or do you feel disconnected from a senior loved one who lives at a distance? The folks at GrandPad have come up with the perfect solution, an easy-to-use device that connects older adults with family and friends using video chat, email, photo sharing, and more. Visit grandpad.net for details. You know, we always say that it's going to be a good interview if somebody cries.
Yeah, I think I cried. I think our guest cried.
Yeah, that's right. That's right.
It's awesome.
I came pretty close, but I won't confess to...
It's not your turn.
Okay.
So our guest today is a friend. I've known him for a while. We invited him to be on the show. Nathan Yemane is a hospice social worker. He has his master's in social work, and in 2013 got his clinical license in social work. He's been in healthcare, working primarily in hospice since 2010.
So Nathan and his business partner, David Turner, are working to establish the first Black-owned hospice in Washington State, which is one of the things we're going to be talking with Nathan about, is how he was able to get this started, because it's not easy to start a hospice agency. But he has a bigger motivation behind this too.
Yes, a personal, very personal motivation.
Right. To help change some of the racial disparity that's occurring in healthcare and very specifically in hospice.
Okay, so here is our interview, our conversation with our friend and hospice colleague, Nathan Yemane.
Nathan, it's a pleasure to welcome you to the Heart of Hospice podcast.
Thank you for having me. I really feel honored to be here.
We got connected with you a couple of years ago. In fact, I think you kind of reached out to us, and we had a great conversation back then. And you were living in Oklahoma City back then, but you're not there anymore. Tell us how this transition took place.
Sure. So I moved to Oklahoma to attend school. I grew up in Auburn, Washington, here in King County. When he went to college, even a little bit here at Green River Community College. But then school was cheaper in Oklahoma. So I went out there. Got my master's in social work from the University of Oklahoma, and was working in the hospice field after that. I also did some other type of work. But, an opportunity came up for me to be able to do hospice as a governing member of a hospice. The potential came about through my relationship with my friend and somebody I consider a mentor. His name's David Turner. He and I began talking about establishing a hospice, and Oklahoma, there are a lot of hospices there. It's a very saturated market. And one of the things that we thought about was looking into a certificate of need state, and also a place that I was familiar with. And so, having grown up in Seattle, having a lot of connections, and also, my family, my father, before he passed in 2020, was a staple in the Seattle community as a grant writer, as a community organizer, as someone that networked with so many different organizations and bringing about good changes in the community. I thought about starting a hospice as a way also to continue his legacy and to continue the work that he started, just in a different way, but still being there for the community. And so it made sense to apply to establish a hospice here in King County, Washington, because I grew up here. My roots are here. Like I said, I'd left for a little bit to go to school in Oklahoma. I also met my wife there. my kids were born there, but it made sense to come back here to do an essential, very necessary work. And again, like I said, something that I felt would help to really further my father's legacy.
That's awesome. So we want to hear more about the story of starting the hospice there, because that's a very unique story to tell. But let's go back a little further and kind of go back to your beginning in hospice. Helen and I have told our stories about how we got into hospice, and we sort of just fell into it.
Mm-hmm.
Wasn't something that we said, oh, we want to work in hospice. In fact, for me, it was just the opposite. I was like, I don't think I want to do that. And then when I got started in it, this was my niche. This was my calling. This is what I love. So tell us how you got into working in hospice as a social worker.
Yeah. So when I graduated with my master's in social work, I was actually, whenever I was going to school, this was even before I graduated, I was working for a nationally funded program called Systems of Care. And there was a wraparound program that incorporated, the multidisciplinary approach to providing services. And I really appreciated and thrived in that environment. And so, and that always stuck with me, even after I'd left that job and I was getting my master's in social work and not really working. I had a part-time job, I think, working at Starbucks for a few months, but that didn't work out. But I was a full-time student. But when I graduated with my master's, I wanted to come back to, an environment much like the one that I had when I was with Systems of Care. And I found out that, so I knew about hospice when I was in grad school, but very little. We didn't have anyone from hospice come in, and there was really little focus given to hospice. Sometimes I think in MSW programs, and in my experience, a lot of emphasis was put on counseling, going into the counseling field and therapy, psychotherapy specifically. So I didn't really know a whole lot about hospice, but after I graduated, I found out that hospice has that multidisciplinary approach also, where you work as a team, where you are able to address the needs and the goals for the hospice patient and their family, and just being able to support them well. And so I applied. The way that I'll tell you this, the way that I applied at a hospice, I didn't know what hospice to apply at, but I was driving down the road. I saw this Chevy Aveo, this little tiny small car with a hospice sign on it. And I said, okay, I'm going to try that number. So that's how I ended up with my hospice job. I called the number that I saw in a small car zipping by.
So was that your first hospice job? Did you get hired on there?
That was my first hospice job. They
That's
asked
awesome.
Me, how did you find out about it? Was it through a friend or I said, no, I saw one of your little small cars drive by me. And so, I was able to get plugged in and, take a lot of the experiences that I had working in a team oriented environment. But then I had a lot to learn too. It was a pretty big learning curve. Just doing work and within the death and dying field is a huge learning curve. I didn't have I don't have some of the stories that people that I know and I respect and value in hospice have, which is I never had somebody personally that I knew or related with that had gone through hospice. But once I came into hospice, there were events and stories and situations that really helped open my eyes into the value of this work, and again got me through that learning curve.
Yeah, I think the interdisciplinary approach is so unique that we couldn't do the work that we do, take the wear and tear from the work that we do without having that team that says, I'm walking the same thing that you are.
Yeah.
To be immersed in a team and surrounded and supported by a team. I really think that does make a lot of difference. We work so autonomously out in the field, but you've got this whole team of people that you can rely on to help take care of the patients and the families. I think that is a very unique and very valuable characteristic of what we do in hospice. Yeah, for sure. So, Nathan, let's talk some about end-of-life care inequities.
Mm-hmm.
We wanted to talk with you about this because you are intentionally serving a population in Washington State with those inequities in mind. So there's a huge dialogue across the United States.
Mm-hmm.
End-of-life care inequities have escalated greatly in the U.S. So what trends do you see in how people of color are engaging with hospice care?
Just wanted to clarify one quick thing is that, yes, our focus as a hospice is to really key in on the underserved communities, especially, as you said, Black and BIPOC communities of color. But I also just, a lot of people ask me, well, if you're doing that, is that all that you do in terms of serving patients? Is it just underserved communities that you serve? And the reality of that is that we are here to serve everybody, all patients, regardless of background, regardless of race, gender preferences, faith backgrounds, whoever these people are that are needing hospice, we are prepared and equipped to provide care for everybody. Now, within that, that mission is this very important goal of ours, which is to address the needs of underserved communities. And to answer your question, the trend that I see is that the more grassroots and community-oriented the hospice care becomes, especially when it comes to underserved communities, the more people of color are going to engage and be more engaged with hospice care. There's just been a long history of mistrust between communities of color and healthcare systems. This is due to, several examples that I could give, going back to, instances like the Tuskegee experiments. Some of us are very familiar with the story of Henrietta Lacks, where her cells were taken without her consent or without her family's consent. And as an African-American woman who did not know what was being done to her body, and that experiment led to, really the multiplication and duplication of an industry. There's several examples where there's valid reasons to not trust healthcare systems. There are hospitals that have been built on land that was taken away from people of color. Eminent domain and other means were used to remove people of color from their neighborhoods and from their homes so that hospitals could be built. So, as a person of color, how could you go to a hospital that was built on where your neighborhood used to be? But then you go a little bit further and you think about how can you, as the child of somebody that had their home taken away, or as the grandson or great grandson, knowing the history there, how do you trust a medical system that exists on land that was taken away? And so there's just a lot of history, a lot of mistrust. And, and I think, and I believe, and there's data that backs this up, studies that back this up, that lack of trust is primarily why there's low participation rates in hospice amongst African Americans, Native Americans, and other people of color. So I think that the more grassroots and community-oriented efforts are made to regain that trust, to mend that trust, I believe there will be more engagement with hospice care. When I say grassroots and community-oriented work, I'm talking about being community-based. Community-based doesn't just mean you have an office building in the community you serve. It means that you're building relationships with and are supportive of the staples of the community, the clergy, the faith communities, community centers, and the longstanding local community organizations, like the urban leagues, NAACP organizations within that community, and just really making formal and informal connections with leaders of the community. That means things like meeting for coffee and talking about, hey, what are the needs that your community has related to hospice? How could we help you with that? And just being able to show willingness to be present, supporting their events. One of the things that I remember doing as we were planning to establish a hospice is New Hope Missionary Baptist Church, which is a church in Seattle. They were working towards regaining land that had been taken away from them by the city because of eminent domain, and they were really gathering resources and support, and we were able to help with that. That has nothing to do with hospice directly, but it just shows that sometimes you have to think about ways to connect with the community as a hospice provider, where you're meeting their needs. They're a part of the underserved community that's there, and it's just good to be present. And so collaboration has to take place. Another thing I would like to say too is that you cannot just say that you're community based if you are in no way reflecting the community you serve. And what I mean by that is that you have to think about what is it as a hospice provider that shows that you reflect the community? Do you have staff? Do you have not just staff, but maybe people in leadership, senior leadership that reflect the people in the community? That means a lot. That means a lot because of the importance that a lot of communities of color value in that they want to see somebody that looks like them on the other side. Right. Because that helps build trust. That helps establish trust.
When you think about the kind of provider, right? So you have a team member that comes out to your house. I think a lot of times we want to see somebody that can relate to who we are, to where we live, the challenges in our neighborhood and our communities. Hospice was never meant to be insulated away from the communities. Even regulations ask for us or direct us to do end-of-life education, hospice education out in the community. And our spiritual care is designed to collaborate with faith communities, faith leaders out in the areas we serve. So we were never meant to be entities unto ourselves. That's the way I see it. Mm-hmm. I mean, the best practices in hospice, the most thriving, engaged hospice agencies are agencies that are active in their communities and involved and engaged and have ownership in the success of not just their own business, but how their community thrives.
Right.
I think that's relatable. That's relatable. These people that are coming into my home, know what it's like for me to live here.
Yes.
They have an ownership that's more than just the ownership of a business.
Yes. Yes. And they're interested in knowing what role you've played in the past or currently playing in terms of being a part of this community. And I just really believe that it's important to have that organic fit in the community as a hospice, where there's that seamless presence in the community, and I think that could be done. Like you said, hospice agencies don't have, nor the hospice industry itself doesn't have to silo itself.
Right.
Today's episode is sponsored by the team at GrandPad. They recognize that older people can be intimidated by technology. GrandPad is created to be easy to set up and effortless to use. The device allows for email, games, music, and photo and video sharing. When you live at a distance from an older loved one, GrandPad is the perfect way to bring everyone together for the holidays. If you're looking for a holiday gift for someone who has it all, consider purchasing a GrandPad subscription. GrandPad comes with 4G LTE cellular service already included, so there's no need for Wi-Fi. Creating a family network is as simple as sending an email. The company has built a platform that empowers seniors of all ages and technological skills to safely connect with family, friends, and caregivers. No spam, no robocalls. As part of the private network, you can share your photos and see what other members of the network are sharing. My mom has a GrandPad and she loves seeing photos of her grandkids and great-grandchildren. GrandPad can keep your family connected for the holidays and beyond. You can find more details at grandpad.net. Now back to today's episode.
So, Nathan, we know from studies that communities of color do not engage hospice as much as other communities do. And we've seen that there's been a lack of engagement from hospices with communities of color. So what can we do to change that? How can we improve those numbers so that people of color will utilize hospice more than they are now? What can we do to make that change happen? You know, we talk about how many people of color actually prefer going to a physician who is of their same race because they feel like they're going to get a better hearing with them than they would if they went to someone else. So is that going to be the same way in hospice, that people of color will actually engage more in hospice who is actually run or owned by someone of color?
I think that's part of the answer. I don't think that's the only answer. I think it's impossible for the change to occur if we're only depending on hospices that are either owned or run by people of color or African American, Black, Hispanic. So the thing that I think is key in really changing the perceptions that a lot of people of color have, misconceptions that a lot of people of color have about hospice, is not necessarily to focus on the perceptions, but more so go a little bit deeper and start to address the social barriers and root causes that have shaped these perceptions. And the best way, I think, to do that is to really take time to understand the current barriers to hospice for underserved communities, for people of color. And what this requires to me is a long look at studies focusing on the data, statistics, and research in regards to things like racial disparities in hospice. So when I say studies, I'm referring to things like medical journals. The NHPCO has resources, just reliable sources for data on hospice-related matters, specifically racial disparities. That is the barrier that you as a hospice entity are seeing in your community. Study it. You know, I was able to gather a lot of data and information along with our consultant when we submitted our application. We were able to gather a lot of data, local and national data, from places like the American Journal of Hospice and Palliative Medicine, Journal of Palliative Medicine, just to name a couple, JAMA, another one. The reason that we did this is because we wanted to paint an accurate picture of what racial disparities in hospice look like. And you can't do that unless you're doing studies and you have data and research that is backing up what you're saying. And the thing is, that I will say this, there was a recent journal that had come out about the lack of research that's being done on racial disparities in hospice. And the study, they picked one hospice journal, and they found that only 7% of, the hundreds of articles that had been and journal articles that had been done by this medical journal, only 7% focused on racial disparities. And so there's little focus given to it right now, even though it's a much bigger problem than what attention is being given to it right now. But even with that 7%, when we applied to the Certificate of Need program, we had enough information from that 7% worth of studies. And again, I'm talking 7% as it relates to that specific journal. I'm pretty sure the numbers are not really that much different when you look at the bigger picture, but we were able to take enough data and research to apply to our cause for wanting to establish a hospice here. Another thing I would like to say is that I got on this path of doing deep dives on particular subjects related to hospice and doing studies, data, research some years back. And Jerry, you're going to relate to this.
Okay.
But I was working for a hospice, and the issue of doing accurate bereavement assessments came up.
Okay.
So the social workers and chaplains, we were just discussing and kind of wanted to start looking into and sharing educational resources and studies, which focused on things like different risk categories, factors that we were assessing, risk inventories, screening questions. And we were able to find evidence-based information to help inform how we do bereavement assessments. I remember talking to social workers that I was supervising, and they would say, you know what, I don't really mark high risk for a lot of my bereavement assessments. Is that normal? That's a good question.
It is a good question.
Unless you have data and research and studies that you've done, and you know that it is normal based on evidence that is seen in these medical journals. It's hard to have confidence that you're doing the right work. Sure. And so that's when I really started, like I said, doing deep dives and kind of studying these things, and it helped to kind of think about broader and bigger subjects like racial disparities in hospice.
Right. Well, I would like to be able to dig a little bit deeper into this with you about the bereavement assessments. I think that would be interesting. That's not our subject today, but we may need to have you come back and talk about that again sometime.
Yeah, I can feel that conversation would be a big one.
It would be.
There's not enough dialogue about bereavement for sure.
That's for sure.
But what you're saying is if hospices really want to be intentional, they have to know what they're dealing with. And I think you're right. I think it's so much bigger. Hospice isn't siloed. Hospice is part of a huge healthcare industry that has a nasty history. And let's face it, the healthcare industry and its history is reflective of the social history of the United States.
Right.
So you're talking about this huge thing. And the point spread on underutilization is big. The Caucasian population has a much higher level of engagement in end-of-life care, utilizing hospice, than do people of color, Pacific Island, Asian, Native American, Hispanic, Black. And it's almost like a 18 to 20 point spread. I'm going from memory. From a study, though, you'd be proud of me, Nathan.
Yes.
But it is huge. So we're looking at undoing our little corner of the world, but having to consider it within this huge framework of historical, social, community, all this different, very complicated perception. It's definitely not something that you can undo overnight.
Yes.
I mean, the United States right now is struggling to make its way and have these conversations. I mean, at some point, we just have trouble having respectful conversations about stuff like this.
Yes. And, especially when the need is great. And especially like, for instance, within the Black and African-American communities in this country, a lot of people don't know this, but when it comes to 3 of the 4 most common hospice diagnoses, African Americans have the highest mortality rate. When it comes to 3 of the 4 most common hospice diagnoses, and based on that fact, that study, obviously more African Americans would benefit from hospice because they're higher than everybody else when it comes to mortality rates in those areas. So it's education. It's being able to share facts like that. And it's really, to be honest with you, it's about hospices caring about facts like that.
Yeah, absolutely.
Hospices have to care. If you don't care, there really isn't going to be much of any change. And I'm talking about from top to bottom. It's great if the social worker or the chaplain or the nurse is excited about addressing racial disparities, but if those that have the decision-making power and those that are in the governing bodies don't care, things aren't going to move.
Right.
Yeah. It all goes back to being engaged in your own communities.
Yes.
Yeah. Do you care about the people you serve?
So let's talk about this in a very personal way. You told us early in the interview that you had moved back to your hometown to actually start a hospice. And this might be a good way to educate our listeners about how a hospice would get started these days. And you have obviously very personal insights into how this happens and what the steps that a person has to go through to actually start a hospice. You're in Washington State, and Washington State is one that requires a certificate of need. So this is a little bit more involved than it would be in any other state, such as Texas, for instance. So tell us about your new agency. Tell us about the mission that you have there, and tell us a little bit about the steps that you went through to get this started, and perhaps even your motivation to start.
Yes. As I mentioned earlier in the podcast, our mission and kind of what we're about as a new agency is to provide compassionate end-of-life care, education to our patients, their families, and our community. And we want to be able to provide that to everyone in this county. That's something that we're very intentional about. We talk about being an agency that really understands and values cultural competence. But that cultural competence is not just reserved for underserved communities. That cultural competence is reserved for everyone, because everyone has a culture. Everyone has a background that they come from that requires, respect and some form of being able to relate to them in a way that is meaningful for them. And then within that mission, we want to really serve those who've been traditionally underserved in our county, and work with community agencies that are passionate about the same, and really work to provide education in ways that maybe education has not been provided about hospice in these underserved communities. And so that's kind of our mission. And then like I said, we have a mission within a mission, which is to really address the underserved in our county. As far as just kind of the process that we went through to start this hospice, what I'll say is that the certificate of need program is quite different than, like you said, in the states that you mentioned, Texas and Oklahoma and California is not a certificate of need state. Oregon is not a certificate of need state. So the process is quite different. You have to show that there's a need for your existence. And if you cannot do that in a way that really convinces the Department of Health, then you're not going to get approved. And so we had to do that. We had to show that there truly was a need in the county for our hospice to provide services, a need that wasn't really being met, or where the numbers were not showing, the data is not showing that this need is being addressed or being met. And so we submitted an application with the facts, but then also with what our approach is going to be, and with what solution we hope to bring to address this disparity, the racial disparity in hospice. And so we were able to do that successfully. And so now that we've done that, we have Medicare and Medicaid certification that to go through, because we were just approved by the Department of Health in September. And so we're newbies, but at the same time, my partner, David Turner, he and I connected primarily because he was doing the very thing that we're doing now in King County in the Seattle area. He was doing that in Tennessee, in Nashville. He established the first Black-owned hospice in Nashville, Tennessee. He went through the Certificate of Need program there. He was able to really show the state of Tennessee the need for a hospice that was going to focus on underserved communities. And that hospice in Nashville was actually covered by NPR about a year ago. And it was the first time I'd ever seen NPR or any national news, media talk about a Black-owned hospice, or a hospice that was specifically focused on the needs of the Black community. And so, David and I have been, communication and relationship for a long time, and I'm glad that we're able to do, or we are on the path of being able to do what they've done and what he's done in Nashville. And in that sense, I have that confidence too, in knowing that this isn't a completely new thing. That it's been done and it's being done in Nashville. He also had done it in Detroit. Just to kind of give you an idea of where things are at, where things, how far we've come.
Right. Yes. So this process has taken some time as well. How long has it been? You said you just got the approval for your certificate of need in September. How long ago did you get started?
A long time ago. We prepared for months. Before submitting our application in December of last year. Wow. So our application was due in December of last year. And then there's like multiple steps. And, to me, I know that there's, it's a pretty rigorous process. But I do know what they're trying to do, and that they're wanting to screen and make sure that any hospice they provide approval to really is a deserving hospice. Sure. They ask hard questions. They allow you to be able to do things like request for a public hearing, which we did. We requested for a public hearing because we wanted the State Department of Health to know that that we really are a part of the community, and that we have people in the community that would like to share their thoughts and voice kind of their opinions about the accessibility or lack thereof to hospice care for underserved communities. And so the nice thing about that is that we didn't tell people, hey, say this, say that, do this, do that. We just said, here's an opportunity for you to voice your thoughts. And a lot of these folks that showed up had never taken part in a public hearing for, hospice applicants applying to, get into King County. So I thought that was great. Because it allowed for community members to really be a part of the decision-making process. They weren't just told, here's the hospice that's going to be in your community. They were given an opportunity to provide comments, to share their thoughts and ideas. And I thought that was great.
To me, it's just indicative of the fact that you're engaged in your community. Again, you have ownership and ties into the community. Although it's a horrible process, you've told us other details about it before, and we're not going to go into the regulation part of it because it's very complicated. But there are benefits to it, right? You don't get a glut of hospice agencies, and we struggle with that. California and Texas struggle with the number of hospice agencies and the competitive nature of it. But kudos to you and your team and to David Turner for sticking it out and getting through all that, because it really is, it's a very, like you were saying, rigorous process to get a certificate of need. So we're so happy that you're going to be able to do that. It's amazing.
Thank you.
Amazing work.
Thank you. Yeah.
Especially carrying on your dad's legacy. That's pretty awesome.
Yes.
Oh, absolutely.
And this is kind of how you're connected to community, is that when they know your dad and they know kind of the legacy, it's not hard to support something connected to that person's legacy. And I would share the story of my dad to many people, not necessarily because he worked in hospice, but because he cared about the community. He was very much an advocate, a community advocate. In fact, the city of Seattle wrote a proclamation for him and gave him, they designated a day for him. December 6th was designated to my dad. And in that proclamation, they talked about all the things he accomplished for communities of color in Seattle and King County. And I've taken pride, and I've always associated his legacy to what I do now, what David and I are doing now, because that's how you work in, especially in communities of colors, that you stand on the shoulders of those that have gone before you. You stand on the shoulders of achievements that have improved and are the reasons for the betterment of the community you're serving. And you don't want to be ignorant of that. You want to acknowledge those things. And so it's with great pride that I do that in honor of him. And some of the most rewarding and sometimes emotional instances is when I'm meeting with community leaders, and they say, "Hey, let me tell you a story about your dad."
That's awesome.
Let me tell you something. Something that he did for us, for our organization, some years back, and I get to learn new things about my dad that I didn't know about in terms of what he did for a community organization, a grant that he helped write, an event that he helped sponsor, things that really mean something to me and help me continue to feel connected to my dad.
Yeah, that must make you so proud. I love it that you've got your kids there where you grew up, where your dad's legacy is very visible. And now as you carry on your dad's legacy, but with your own spin, right? Your own brand of what you're doing in your community, and your kids are going to get to see that, Nathan. I think that's an amazing contribution, an amazing way of nurturing your family. I think that's pretty awesome.
I think you put it beautifully.
So we want to kind of close out this interview with you with a personal question. So as a hospice social worker and now as an agency owner and administrator, what's been the most meaningful part of the work that you do in hospice?
We're assuming it's not the certificate of need.
Again, it wasn't an easy process, but I'm glad we went through it. I think it's good that it's there. I know that it doesn't make it easy for someone applying to go through that many steps, but I had great communication with the people that worked there. I felt transparency, and I felt that they were pretty accessible, to be honest. So, again, not an easy process, but the people there are great. What I'll say about the most meaningful part of this process for me has been, I would say the people that I've met, the community members, and the stories that I've heard. I'll tell you one thing. Pastor of Bethel Ethiopian Church of Seattle, someone that I've known for a while through my parents. He pastors the second largest African church in the Seattle area, which is, means a lot. It's a big church. His name is Pastor Brahanu. And, I was talking to him, and he even shared this because he was present at the public hearing. He shared this at the public hearing. He said, when some of my parishioners, those that are members of my church, when they have a loved one who's at end of life, or if they themselves are at end of life, he said, I am hospice. He said, I'm the one that goes to the hospital. I'm the one that goes to the home. I'm the one that's there providing spiritual care and consoling. And he said that it meant so much to him to have the conversation with me and know that he could have support when he's dealing with somebody that is at end of life care, that he has someone to call, not just in terms of providing good clinical care, but good culturally competent care, that he's not by himself. that he doesn't feel like he's hospice by himself. You know,
Right.
it's one of those things. It's one of those things where you realize there are people in our community, there are people in our city out there. They're just looking for the answers. You know, who can I call when someone in my church is dealing with end of life issues, when they've been diagnosed, or they're needing resources for funeral arrangements, and you know, making plans and advanced directive questions and things like that. You know, and for him to say that at the public hearing and just say, "Hey, I'm glad, you know, Nathan and his agency are applying because I need them." That meant a lot to me. That's just one example of many I could give you of just the ways in which I feel like I have been and will continue to be, and that we have been and we will continue to be a resource for the community.
I love that. I've never heard faith leader out in the community describe it that way, but it makes total sense.
Yeah.
A lot of that responsibility that should go to the hospice, that can go to the hospice, because community clergy are part of our team.
Yes.
So what an awesome way to put that. Good perspective, I think.
It is.
Yeah.
Nathan Yemane, we're so glad to have you as a friend and so proud of what you're doing there in your community. We are just so thankful for you and the way that you are moving forward and leading in this effort to create a better world. And I'm just grateful for what you're doing and thankful.
I appreciate you. Thank you so much for what you guys do and providing just necessary education for the public in regards to so many aspects of hospice and just hospice in general. I think education is key. It's key for what I do. It's key for what you guys do. I just am glad that you are a resource for so many people that maybe without you guys would not learn and not know about hospice. So I thank you for what you do.
They're doing an amazing thing. Not an easy thing. I didn't say it was easy. Just the regulatory processes, in addition to the business building that it takes to start a hospice agency, that's a handful.
Right.
Nathan and David Turner are tenacious. They're driven. They're building something important. Not just a hospice agency that serves patients, right? They understand that there's business that goes with it. But there's a heart behind that.
Right. And it's more than just a mission. It's more than just a business. They are really pursuing something that gives them great passion. And they're pursuing this with a passion because what they're doing is very personal to them.
Yes. Yes. And the fact that Nathan is standing on the shoulders of his father and the work that his father did in this Seattle community, it's just an amazing way of carrying on his dad's legacy and showing Nathan's kids and the community where Nathan and his family live what can be done, what can be built, the good that can come from work and calling,
right,
like he has.
And what a great connection, a partnership that Nathan has with David Turner. And David has done this before. He has started other hospice agencies, one in Tennessee, one in Detroit. In fact, Nathan mentioned in the interview that David had been featured in NPR. And we're going to link in the show notes to that article. So just take a look in the show notes. If you want to read that article and find out more about David Turner and what he's been doing, we'd encourage you to do that.
Thanks for listening to The Heart of Hospice. I'm Helen Bauer here with Jerry Fender. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening, and please leave a rating or a review.
To connect with us, just send us an email to host@theheartofhospice.com. You can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.